Like most 8-year-old boys, Lucas Lawson of Portland, Oregon leads an active life. He loves to snowboard, drive go-karts, go camping, and ride the rapids. It's hard to imagine doctors once thought he might end up blind. Lucas was born prematurely at 26 weeks. After 2 months in the hospital, his parents thought they were out of the woods as they prepared to take him home.
They mentioned the possibility of retinopathy of prematurity. We had no idea what that was.
Retinopathy of prematurity is a common problem for babies born prematurely, occurring in more than 2,000 infants each year. 500 of those end up blind. The Oregon Elks professor of ophthalmology, Dr. Earl Palmer, is a world-renowned expert on ROP.
One of the last parts of the body to develop in a baby before it's born are the blood vessels that line the eye, the retinal blood vessels. The blood vessels grow out of the optic nerve and they branch on the inside of the eye on the retina. By the time the baby reaches full term, these blood vessels have reached the front limits of the retina. If the baby doesn't reach full term before being born, these blood vessels are farther back. Later on, when the oxygen supply starts to reduce toward normal, there isn't enough of a blood supply for the retina, and it damages the retina, the inner lining of the eye, and can lead to a growth of scar tissue inside the eye that can cause the retina to detach and lead to complete blindness.
They referred us up to the Elks Children's Eye Clinic at the Casey Eye Institute. Dr. Robertson looked in his eye, in my son's eye, for 30 seconds, I think, and said we need to schedule him for surgery immediately. And the next day, he was scheduled to go in for surgery.
Suddenly they're confronted with a new and very severe diagnosis.
You're looking at potential blindness of your child, which was pretty traumatic.
After the surgery to repair the detached retina, Lucas's parents had to wait until the next morning before Dr. Robertson could begin to evaluate the results.
When he looked in his eye, he looked in there, and I remember him saying, look, he goes, his retina is crystal clear. And I remember him saying, that's pretty rare to see that, but we feel comfortable with what we see so far.
This operation was amazingly successful. If Lucas had been born at the time when I started my career in ophthalmology, most likely he would not be seeing at least in one eye and possibly in both. If Lucas had been born 50 or 60 years ago, the outcome would have been very, very different.
Lucas benefited from decades of research, much of it funded by the Oregon Elks. In the 1950s, Dr. Kenneth Swan, a leading ophthalmologist and head of the Department of Ophthalmology at the Oregon Medical School, spearheaded treatment for this disease. He had noticed that many premature babies become blind. 2 of his early patients were the twin sons of Judge Robert Mulvey. Both Dr. Swan and Judge Mulvey were Oregon Elk members and were instrumental in getting the hospital and the Elks to join forces with a declaration of interdependence to fight vision problems.
In the 1950s, we started being able to keep very premature babies alive, but the way that was done was by giving them oxygen in incubators. And what we soon found was that with giving babies oxygen, it led to a severe problem with their eyes, and many of those babies would become blind. And research was done under the direction of Earl Palmer, who organized really an international study of how to treat retinopathy of prematurity, and showed that the disease could be treated by doing a special freezing treatment to the eye of these babies, and that would preserve vision in a large number of the babies.
The study found a significant reduction in blindness when this freezing technique was used. It was the Elks Children's Eye Clinic which provided the seed money as well as funding for the initial organization of the pilot study.
The work that goes on in the laboratory that might allow us to treat a disease or prevent it from ever occurring is really vital, and that's part of the unique mission of the Eye Institute, to be doing that type of work rather than just treating patients' diseases. We can treat glaucoma, but we can't cure glaucoma. We can treat macular degeneration, but we can't cure it. And research is really the way that we go about curing disease rather than just treating it.
The Eye Clinic's research department recently moved into space in the new Biomedical Research Building, more than doubling its capabilities. Once again, the Oregon Elks provided funding to help make this happen. One of the studies being conducted there is attempting to find a way to prevent ROP using medication in the blood vessels instead of current methods using lasers.
We've moved to this new floor because we've been so successful. We ran out of space, we brought in new investigators, we brought in new grant dollars.
With more space, even more grant dollars can be sought to provide the extra funding needed to do additional research, speeding up the rate which new treatments can be brought to patients.
People hope within the next several years to bring it from the bench to the patient and hopefully have clinical trials in the next several years.
Today, Lucas is able to live as a normal 8-year-old.
With his glasses on, it's 20/40, and the eye with the weaker vision, the stronger vision, it's been 20/20. Initially, we were told he would be lucky to see 2300.
His ability to see out of the left eye is becoming stronger and stronger and stronger. It's a wonderful thing, that's for sure.
If you can hope for a 20/40 visual outcome, good enough to pass a driver's vision test, that's considered awfully good.
We would certainly like to thank the Elks for everything they're doing up at the Elks Children's Eye Clinic at the Casey Eye Institute. It's a wonderful thing to have an organization like that.
We're fortunate that they're there.
To make you feel comfortable.
Support that we get from the Oregon State Elks is unique for eye departments, and I can tell you that we're the envy of other eye departments, that we have such a fine affiliation over the years with such a great institution as the Oregon State Elks. And some of you may know, but some of you may not know, that my own son was a patient in the Oregon State Elks Clinic. He had lazy eye, and I was very proud to be able to bring him to the Oregon State Elks Association and their clinic so that he could have treatment.
Knowing that people are supporting this in a real way motivates you to really want to give back.
A group of people trying to do the right thing over a sustained period of time, like the Elks, it can indeed and do indeed make a difference.
A difference you can literally see.